Morning, everyone, and welcome to the final meeting of the Long Island Health Collaborative for this year. We are recording this meeting, and so by virtue of attending, that is your acceptance that is okay with you. So just wanted to set forth that disclaimer at the start. Very happy to have everyone together. You know who I am, Janine Logan, Director of the Collaborative. To my right is Brooke Olivieri, who helps manage the Collaborative and has some other titles as well. And to my left is Hannah Moore, and they can introduce themselves, who is our Director of Community Health Strategies. We had to change her name when DEI kind of went out the window.
Morning, everybody.
Change her title. So we'll go quick around the room and just quickly say your name and your affiliation, and we'll get going. We have about 25 of us on the screen. So I'll start with who I see up on the screen first. So I see Gary Carpenter. He was on. I think Gary.
Good morning, everybody. I'm Gary Carpenter, and I run a management consulting firm specialized in the home health care industry, a statewide program. And I also help constituents, a lot of individuals in Long Island, navigating the maze of home health care. On my side, I sit on the board of St. Catherine's of CHNA Medical Center.
Wonderful to have you. Good morning, Dr. Tavora Buckman.
Good morning. Tavora Buckman. I'm the Director of Epidemiology, Biostats, and Planning at Nassau County Department of Health. Nice to see everybody.
Yes, you too. Good morning, Kelly DeVito.
Good morning. This is actually Maddie McBullion. I just used Kelly's login because mine wasn't working.
Sorry.
So I'm from Horizons Counseling and Education Center in Smithtown. I'm the director here.
Good to have you. Hi, Miss Selena Cabello.
Good morning, everybody. This is Selena from the Nassau County Department of Health, and I work with Dr. Buckman. I'm the Assistant Director of Epidemiology, Biostats, and Planning.
Good morning, Georgette.
Good morning, everyone. Georgette Beal, Senior Vice President for Planning and Grants Management at United Way of Long Island. Nice to see all of you this morning.
Good morning, Nadine.
Good morning, everyone. I'm Nadine Wilches, President and founder of MindArc Health, a preventive technology company reducing risks of stress-related disorders.
Good morning, Alicia.
Good morning, everybody. I'm Alicia Collinbell. I'm the Outreach and Partnership Specialist for Nassau Library System here in Nassau County. So I work with all 54 public libraries throughout Nassau.
Very nice to have you on. Good morning, Rodrigo Valles or Valle.
Valles. Hi, everybody. I'm Rodrigo Valles. I'm the new director of the Office of Health Equity and Climate Medicine Research at Stony Brook, and we span a lot of different parties, a lot of different disciplines. It's great to be here.
Mm-hmm. And I have another Selena, but I know it's not a Selena. It's I don't know. It's a person with a yellow shirt on. Sorry.
Holly, that's you. Holly Morano. It says my name.
What?
Holly.
Well, that's a little odd. Okay, hi, my name's Holly Morano. I actually work in the Bureau of Outreach under the Division of Community Health, which is run by Nina Skolko, with the Nassau County Department of Health.
Hi, nice to see you.
I have no idea why Selena. Oh, I know why. Anyway, thank you. This is my first meeting with the Health Collaborative.
It's okay. No worries. Hi, Chantel. Good morning.
Good morning, everyone. Chantel Brown, Senior Director of Social Care Networks at Sun River Health. We operate 17 sites in Suffolk County and Long Island. And this is my first meeting. I was happy to be invited by Janine Logan.
Thank you so much, Chantel, for joining us. Brooke, you want to do give a little shout out for yourself here?
As Janine said, I manage the alongside her and Hannah, and I manage communications, health outreach, and research here at the Nassau Suffolk Hospital Council.
She does a lot.
Good to see you all.
Hannah, you want to give it?
Sure. I'm Hannah Moore, Director of Community Health Strategies at the Nassau Suffolk Hospital Council. My primary role is working with the hospitals to complete the health equity impact assessments, if you're familiar. But I lend any sort of support to the Long Island Health Collaborative, including the case study project that we are completing this year, and we'll get into that a little bit later.
Yes. Good morning, Dr. Linda Mermelstein.
Good morning. Hi, I'm Linda Mermelstein. I'm the Associate Director for Community Outreach Engagement at Stony Brook Cancer Center. Thanks for having me, and happy holidays, everybody.
You too.
There's Tan. Tan? That's the next person.
Who's next?
I know Tan just joined us.
Oh, hi, Tan Fen.
Hi, good morning. My name is Tan Pham, Community Specialist at Outreach, Substance Use and Mental Health.
Good morning. There's a Maddie McBullion.
She actually already introduced herself, but I renamed her.
Okay. Okay, Janet. Good morning, Janet. Romeo.
Good morning. Sorry, no camera. Janet Romeo, Director of Epilepsy Services for the Epilepsy Foundation, Long Island.
Nice to have you. Sarah Narcisse.
Oh, thanks for letting us
Mike,
know.
Okay. Her mic's not working. Okay. She's Nassau County Department of Health.
Thanks for being here, Sarah.
And we have another Sarah Gross.
Hey, sorry, I'm driving, so my camera's off for the moment. Sarah Gross, I'm the Dean of the Sandman School of Health Sciences at Farmingdale State College.
Oh, hi, Sarah. Yes, we pass one another on the walkways on campus sometimes. Good morning.
Yes, we do. Good morning.
Yes,
Once I get into my office, I'll turn on my camera so you guys can see me. Yes.
Kate Metzendorf, good morning.
Hi, good morning. Thank you so much for having us. I'm a member of the Be Free team, and I'm excited to be here.
Thank you. Sabrina Tehran.
Hi, good morning. Can you hear me?
Yes.
Hi, good morning. I'm Sabrina. I am actually working on opening a home health agency here in Long Island, and I was invited by Gary.
Very good. And I think it's Leah Khan.
Hi everyone, my name's Leah. I also work with Kate on the Be Free team here at Cohen's Children, and I'm excited to be here.
Good morning, Analia.
Good morning. Hi, everyone. I'm Analia Trask. I'm a program coordinator with Stony Brook Cancer Center Community Outreach and Engagement Office.
Good to see you.
You too.
Marissa Bryan.
Good morning, everyone. My name is Marissa Ryan. I work at the Nassau County Department of Health in the Office of Epidemiology, Biostatistics, and Planning. I work alongside Dr. Buckman, Selena Cabello, Sarah Narcisse, and Alana Jenkins.
Great to have you. And Miss Allison Puglia.
Hi, everyone. My name is Allison, and I am the Manager of Payment Assistance at PSEG Long Island, and we help with all of the PSEG bills to help people get discounts and payment agreements.
Okay, we have a few more people, I think.
I'm going to the next.
And Adesawa, good morning, Adesawa.
Good morning, all. Adesawa Watson. I'm the Director of the Office of Minority Health at the Suffolk County Health Department, and we also house a new program called Smart Start Suffolk for expectant parents.
Nice. Alana Jenkins.
Oh, hi. Good morning, everybody. My name is Ilana Jenkins. I work at Nassau County Department of Health in the Epi Biostats and Planning Department.
Nice to have you. Ebony McSomething. I can't see the rest of it, but good morning, Ebony.
Good morning. I'm Ebony McFadder. I'm the Director of Care Coordination here at St. Mary's Healthcare System for Children over on the community program side. And we also provide case management under the Health Home Serving Children program.
Good morning. Nice to have you.
I think that's everyone.
I think we got everyone. If not, let us know. I think we got everyone. Yeah, I think so. Yeah. Great. Okay, so let's move on. We already did that. We welcomed everyone. We did that. Yeah, we're using the conference room, so we haven't used this in a while, so just bear with us as we get our technology up and running. There we are. So, sure, there we go. Everyone sees the screen, sees the slides? Yes, okay.
Yes.
So we have a wonderful way to start off the meeting this morning. As you know, a couple of years ago, we started to present each year a Community Health Champion Award to an individual who has been with the collaborative from the beginning, is continuing to be active in the collaborative, and really has been influential and helpful through the years. And of course, this year, we've got many people to choose from, but we felt that Dr. Tabora Buckman from Nassau County Department of Health was most deserving. She has been pushing us along, certainly from the data side, from the very beginning, and we wanted to recognize all her contributions and all her assistance that she has provided and continues to provide. She's always often a voice of reality and reason that we hear in the background. And so we're really happy to present this honor to you, Tavora. And there on the right, you see a photo up there with Tavora with the former Suffolk County Health Commissioner. And that was at a press event held some years ago with one of the partners we work with, New York Coalition for Transportation Safety, where we held a contest about safe driving and the education laws that exist regarding driving. And this was for high school students, and those were the two winners. And I think it was held at St. Joseph's Hospital, if I recall. So that's Tabora who's there speaking on behalf of Nassau County, and she speaks on behalf of Nassau County in many ways. I recall, Tabora, if you remember, we had a walk with a doc. I think it was a walk with a doc, or maybe it was just a walk way back when at Jones Beach, and we had the New York State Health Commissioner meet us, although he parked in the wrong parking lot and got a little bit lost. But I remember you were speaking on behalf of Nassau County, and you revealed that you were a race walker in college or high school. So thereby your interest in our walking platform all these years. So without further discussion or me yakking away, I would like to let Tabora say a few words, and I'd like to congratulate her again for all that she's done and continues to do for us.
Oh my gosh. Can you hear me?
Yes.
Thank you so much. I mean, I don't know what to say, but thanks so much for the honor. It's been a privilege to work with all of you, with the whole collaborative. I've met so many wonderful, really, really smart people along the way. And, you know, we started this in 2013, and I'm so gratified, honestly, that, and it's really a testament to all you guys do, Janine, you and your team, to keeping this moving along, because it still remains intact and it's expanded, and we've had funding and we've not had funding, and yet we've been able to, you know, continue the process because of the dedication really of everybody. So, you know, I'm grateful for the honor. And I have to say that it is a collaborative, because it's a full team effort. And thanks to all my team and the wonderful people that I work with, in particular, my colleague and dear friend, Selena Cabello, we've been working together forever, moving forward with, you know, the community, Long Island as a whole. So thank you so much. I am a race walker. I was a race walker.
Yes, yes.
And we'll just keep those photos to myself.
So we don't put them in a PowerPoint.
Yeah. Yeah.
If I could have found one, I would have put it up there.
It was back in the day, you know, but Yeah.
So you will be receiving a certificate. We will mail that out to you and you can frame it and hang it on your wall and always be reminded of how important you are and how appreciated you are to us
Well,
all.
thank you. Thank you. And Janine, really, thank you for all you've done. And, I will never forget, Janine, that at the very beginning in maybe 2012, you would say, I'm not a data person. I don't know what we're talking about here. And you have learned it. You have come through this. You can talk about the limitations and the advantages to looking at data in all different ways. So really, it's been a pleasure. It's been a pleasure.
Thank you. Okay, it was such a wonderful way to start the morning, isn't it?
Thank you.
So I just really, one of the highlights of the year is getting to do something, to present an award like this. And recognition, really. It's a recognition more than an award, I would say, for all your work that you've done. Okay.
Thank you.
Sure.
Welcome.
Is Lori on?
No, so let's.
Okay, so we will hear from Lori Andrade in a little bit. Just waiting for her to pop on, so we'll move forward a little bit past her slides. Is it 10 o'clock? Yeah, she's probably waiting. What else can I fill the void with?
I'll move on to some of our initial. Here's Lori actually.
Oh, Lori's here.
She's right on time.
Lori, look at that. You're right. She's in the room.
Let's see. Can you hear us, Lori? Welcome.
Thank you so much.
Oh, hi, Lori. You're right on time.
Oh, good. I'm glad. Excellent.
So good morning to Lori, Executive Vice President of HEALI and the Social Care Network, which is connected to the 1115 waiver. She is directing the Social Care Network for our region on Long Island. And she's spoken to us before, but I did ask her to come back. As you know, the waiver has about a year and 3-4 months to go. Lori and her team have been working so diligently to get Medicaid members screened initially and then send them whoever screens for enhanced services along their way so that they can be connected with services. And at last month's your annual meeting, I think, of the Social Care Network, there was an absolutely fantastic video that they ran about all the work that the Social Care Network has done and their partners and what they've done. So Lori's gonna talk to a little bit about us, bring us up to date on what the Social Care Network is doing. Kind of another call to action. If you're not involved in the Social Care Network and you're a community-based organization and you have a touch point with Medicaid members, we really need you to help us get those members screened so we can hit those numbers that the state wants us to hit and frankly to help the individuals who need the help. So keep that in mind as Lori goes through her slides and then when we see that really great video at the end. So Lori, I'll turn it over to you.
Thank you. I'm just telling Brooke, that if she wouldn't mind advancing my slides, that would be wonderful. That way I can focus on it.
Yeah, no problem.
Thank you. I appreciate that. So, good morning, everybody. I'm so glad to be back with you all. And so, thank you so much to Janine and to Brooke for inviting me back. As Janine said, the HEALI Social Care Network work is well underway. And we've laid the groundwork in the first year to really serve all of the Medicaid members that we're charged to serve. And we're excited to build on that groundwork that's been laid as we have established in the first year. We have 100 CBOs and healthcare providers currently in our network, which is phenomenal to have so many. And each one has navigators that have been trained to do that screening and enhanced eligibility assessment and service provision for Medicaid members. If you could advance to the next slide for me, please. So just as a reminder, all 600,000 Medicaid members on Long Island need to be screened using the AHC screening tool to determine if they have a social care need. From that, we do an eligibility assessment, another set of questions that determines if they're eligible for enhanced services. And first, they need to be in one of these eligibility populations. So yes, they have a social care need. Yes, they're in one of these eligibility enhanced service eligibility categories that they'll meet that criteria. And then there's a couple of other questions that get asked in order to be able to connect them. Next slide. Just to the next slide, please. These services, right? We have, enhanced nutrition services like nutrition counseling, cooking supplies, medically tailored meals, clinically appropriate meals, fruit and vegetable prescriptions, pantry stocking, as well as these enhanced housing services like rent and utility, navigation, community transitional services, pre-tenancy and tenancy, home remediation and education, home accessibility and safety, and medical respite, as well as the care management. The care management is really the glue. It's that community health worker role that helps people go from the screen to the enhanced eligibility assessment. If they're eligible for these services, wonderful. If they're not, they'll help refer them to traditional social care services like SNAP and WIC and those sort of services. If they are, they see that member through the entire journey to access all of these services. And so that's really the member journey and the member experience as they go through this. We've connected. Next slide. So of the 600,000, we've reached more than 500,000 No, we haven't reached 50,000. That should say 50. Sorry. I'm like, that's 500,000. We've reached 50,000
Yes, you get there.
Yes, we're getting there, but 50,000 members so far. And we have another 550,000 members that we need to connect to do those screens. We have healthcare providers that are screening, we have CBOs that are screening, and we have a range of things that we're doing to encourage folks to reach out to members and get them screened. Additionally, we have about 260,000 members of the 600 that are in those enhanced eligibility populations and eligible for those enhanced nutrition, housing, and care management services. And we've reached about 35,000. So we've started, like I said, the ground has been laid. There's a lot that goes into that ground, a lot of training, a lot of technology, a lot of contracting and components. Now that that's been great, we're now ready to go to the next level of really making sure that we connect every member possible. And HEALI receives from the feds to the state through the managed care organizations what's called a per member per month, a PMPM. And those are the dollars that are used to reimburse CBOs and healthcare providers for providing these services. We've received almost $70 million to date for these services, and we've used about $2 million. There's a lot of money on the table to be able to use to reimburse community-based organizations and healthcare providers to provide these services for people at a time when we know there are other nutrition services being cut and there are other housing services being cut. It would be terrible. It would be a travesty, right? If we left these dollars on the table and didn't utilize them to provide these really critical services at this time. And we also know a lot of CBOs are getting cut right now. There are jobs that are at risk, right? Because if those services are being cut, those programs are being cut, those jobs could possibly be cut. We're able to provide these resources to service, to have the CBOs help and the healthcare providers help service and provide these services for Medicaid members. So those are dollars that'll go to those organizations and those to be able to ensure that that staff can continue to work. So all in all, this is really a win-win-win. And we really need to do everything possible to connect folks to these services. Next slide. We're really focusing in. We've hotspotted, they say, looked at the zip codes with the highest numbers of Medicaid members. And none of this should be a surprise. We kind of know where folks are, right? We know which communities are highly likely to have lots of Medicaid members, which zip codes. And these are the ones that have come up for us as the hotspots where we're really laser focusing in. Elmont to Montauk we're focused on, but laser focusing in on where we know Medicaid members are so that we're ensuring we have enough CBOs and healthcare providers providing services. And we're doing a lot of intensive outreach to make sure that we connect to people in these zip codes. Next. So we do a lot to support folks in getting onto the network and doing this work. We start out with contracting. We have a whole team of folks that really work with you to go through the contracting process and go through all of that, pass them over to the training people who help train everybody. Next slide. And being able to provide you as much support as possible. We have created what we call a provider partnership portal, which is kind of a website that's not public website. It's a website for our providers to be able to have all of the information that you need to be able to provide services to people. Next slide. We have a range of job aids on our portal. So I always say 24/7, you wake up at 2 a.m. like I do, and you have nothing to do. We have job aids for you to look at, and that'll lull you right back to sleep. No, just kidding. So they're right there for you 24/7, all of the support that you need to be able to do this work with us. And we are constantly updating these. We send out an email once a week to let you know what the updates are on the portal or what meetings are coming up. Next slide. We also have a learning management system where we have all of our recorded trainings that are available to you. Again, 24/7, you wake up at 2 a.m. and the portal wasn't sufficient for you. Go on our learning management system and listen to our videos. And so that constantly we have all of this training available to you to be able to train your folks. Somebody leaves and you need to get somebody new person trained. We have all of this available to you to support you through this. Next slide. We also have technical assistance office hours. Once a week, we meet at 1 o'clock via Zoom to meet with all of our providers and answer questions. It's really an open session. We let the providers kind of lead us and unless they kind of tell us ahead of time what they want to hear. And so we do all of this training, this TA and training, as well as a ticket system. If there's something specific that you have an issue with on the technology, we support you through that and we respond to you quickly. Next slide. As well as we have technical assistance cohorts, which are deep dive into the nutrition services, the housing services, the care management services, deep dive in to understand the intricacies of providing some of these, because some of them are complex, particularly the housing. When you're doing home remediation, anybody who's ever done home remediation in their home knows that it is complex, right? And so we have a care manager that's helping the housing provider and the Medicaid member through that home remediation process. And so we want to make sure that we're providing enough technical assistance, intensive support in order to be able to provide those services. So we have those technical assistance cohorts also. Next slide. So those are like the process. These are what we're trying to do, right? We're trying to get these services provided. It's our job as the lead entity to provide every support possible, be that in contracting, be that in training, be that in any way possible to support our CBOs and our healthcare providers. It's a win-win. We provide the support if you're a CBO or a healthcare provider with a health home case management agency. We are able to provide you with capacity building dollars to do that. So we're able to provide you with resources to hire the people, go through the training process. And as you have those people hired up, we also are able to reimburse you at the same time. So you're getting in two sources of dollars. In order to be able to do this, we've also rolled out just this month an outreach program. We're paying for people, these CBOs who are in contract with us to do, and healthcare providers to do outreach in community. It's an ambassador program. So, there's a lot of ways we're able to resource this, support it. But we do ask that you join. If you have not yet joined the Social Care Network, we hope that you will consider joining it. We are building a sustainability plan as we go. We can't kind of wait till the end of the waiver to build out that sustainability plan. We're building it as we go. We've heard now publicly twice the Medicaid director of New York State, Amir Basiri, has pledged his continued support of the social care networks. They've poured a lot of dollars into this, a lot of time and effort. They will continue past the waiver. They're applying for another waiver now to the Center for Medicaid and Medicare Services. So that is anticipated, as well as the kind of continued embedment of these programs and of these services in the Medicaid program. At the same time, HEALI is going to apply to be Medicare billing as well and align our Medicaid services with our Medicare services and be able to do both in the future. So there's a lot of anticipation over this, a lot of kind of, excitement over this. The managed care organizations are very interested in the continuation of this also, knowing that when you pay for somebody's good food, you're going to have better health outcomes in the long run. And when you pay for somebody's home remediation or mold remediation, you know that that child is less likely to have asthma, end up back in the hospital. So there's a lot of interest from all around, from the federal government, from the state government, Department of Health, as well as our managed care organizations to continue to participate in this in the long run. So we really encourage you to do this now so we can, A, get those resources to people. Let's not send money back to the feds. If we don't spend down that money, that is a travesty to send money back, right? We don't want to do that, but also help us build something that is going to sustain into the future and be a continued source of support for our Medicaid and Long Islanders in general. So thank you.
Well, thank you so much, Lori. Just, we'll take some questions, but just a quick comment. Putting together a structure like this, right? It couldn't happen overnight, right? It had to take a little bit of time to get it up and running and get, work out all the kinks, which there's still some technical issues that are not worked out. But it would be an absolute shame that we've come this far to have to, we certainly do not, I don't know anybody here on this call who would want to give money back right now to the federal government. No one wants to do that. And it's such wonderful supports. And this is all we've been talking about, right? Those social determinants of health that's really affects health outcomes. And we have this opportunity to integrate those mold remediation services, nutrition services, all those things that Lori delineated to help an individual live their best life possible in spite of a chronic illness or disease that they might have. So I'll stop there. Again, thank you, Lori, for all that you have done and your team has done to bring this along from nothing to something, and continued success. And just a plea to please, if you're a CBO and you have any interaction with Medicaid members, and you haven't yet connected with the Social Care Network, and Lori, please do so. I know her email is, we'll probably send her email and put it in the chat, or when we send follow-up out. But we also, in our collaborative communications, highlight the work of the Social Care Network and have a link directly that you can go to. Even if you wanted to have a member self-screen, you could do that for Medicaid. So we're trying to do our part as well.
Thank you, Jean. I really appreciate it.
Sure. Any questions for Lori?
Lori, I have a question. It's Adesawa. I wanted to thank you for coming to the Suffolk County Health Department or meeting with us to explain more about HEALI. I know that we are not getting reimbursed, but we definitely understand the importance of sharing this with Medicaid members that we're seeing. If we have a home visitor that is out in the community and is having some, she has questions or any issues, should she be coming to that technical assistance meeting? Because I know that's for your CBOs that are a part of the the network.
We can have her, if you want us to give her my information, I'll make sure once I have a better idea kind of what the question is to direct her to the right staff member. That would be fine. I mean, I think for someone like that, it's best to direct that Medicaid member to that self-screener on our website, on HEALI's website, which is what, Janine just mentioned, because they'll be with that person. They'll fill out those 12 questions with the person in the self-screener. And that information goes directly into Unite Us for follow-up, our platform that we use. So we'll immediately have that information. But that's really the best way, if you're not contracted with us, is to help a Medicaid member or provide information to that Medicaid member to connect to our self-screener on our website.
Okay. And if the person speaks a language other than English, do they designate that on the form or?
So our website is translated into many languages. I don't remember exactly how many, but there is the ability to do that. So yes, everything is as accessible as possible from a language perspective in general in terms of accessibility.
Any other questions before we?
I know we wanted to share the video.
I want to share this video, right? Because nothing speaks louder than stories and seeing the successes of the work that you have put in. So that's what I want to do. And so sit back and relax.
Go full screen.
There's a big, big, big gap in what people
Can you all hear that before we carry on?
need to really truly be what we, I think, collectively view as healthy. But this really looks at those social care needs that people have, because without a safe home, without food on the table, you really can't say that somebody's truly healthy, even if they're doing everything that they're told by their doctors they're supposed to do.
HEALI was formed to bring together providers of the region to build a social care infrastructure. We're a network of about 100 community-based organizations and healthcare providers looking to integrate healthcare and social care together. We're screening Medicaid members to identify health-related social needs and then connecting them to services like nutrition services, housing services, care management.
We have two levels of services. We have services that already exist, and we have what's called enhanced services.
And so every Medicaid member in Long Island is going to be screened using a common screening tool. And that is the entry point to be able to access the care that they need.
I think that was the end of the video.
That was the end of it.
I thought there was more, but anyway, what we did show, when you see it like that, right, you saw the screen, how you go onto the website, you can see the self-screen. If you're not providing Medicaid services but know Medicaid members, you can direct them there. But I thought it was a little bit longer, but I don't know, didn't pick up the whole thing.
This is the one yeah, it wasn't the full one is on the website.
The
So that
full
was a
one
teaser.
That was the teaser. The full one is on the HEALI website.
I think so, yes.
Okay. So, but anyway, I think you get the idea. You want to try and find it, or
if you want to.
do you want to see the rest of it? Yes or no? I do. I didn't realize, I think I picked that up I saw it on Facebook and I sent, or LinkedIn, and I sent Brooke the link. I didn't realize that it was just a snippet. It wasn't the whole, because there's your network bandwidth is low.
I'm not sure how to go screen from the website.
Let's just see if we can grab it. If we can't, we'll just move forward.
All right. Do you want me to? I have it out. You don't like it. Got it.
Get me crazy, I'm sorry.
I don't know if you all can hear this.
And we have what's called enhanced services.
And so every Medicaid member in Long Island is going to be screened using a common screening tool. And that is the entry point to be able to access the care that they need.
So the first step is really the Medicaid members connecting with our broad network of social care navigators about what they're experiencing in their life, what needs they have, so we can best serve them.
Community health workers are the front line of reaching out to the most vulnerable members of our community.
I'm able to tell the people about the different doors that are there, and if you knock on them, they can open and you can get what you need.
It's harkening back to how we as human beings are supposed to live, where we're supposed to live in a village, and the village takes care of you.
First of all, I have a lot of health situation going on right now. I'm diabetic, I have lupus, which I cannot deal with stress. I didn't feel like I was getting any help. I wasn't being listened to like what I needed. I contacted HEALI, and I wanted to find out if I qualified for any of the helps that they were offering. And I never got this kind of help so fast. I mean, it was like a stalk. I get somebody else who's working on something for me to make my life easier. And I think we all need that, like especially when you have so much situation going on. We need the help.
We all love the organizations that we work for, but our collective mission on behalf of, 265,000 enhanced Medicaid lives and probably 600,000 lives beyond that is paramount and is more important.
HEALI has developed a platform for us to come together and work together and to find value in our differences and to not feel threatened by the fact that you may do something better than I do.
Not only are we the ones identifying and connecting people to these services, we're actually working with the other community-based organizations with those Medicaid dollars. We're helping distribute it. We're actually helping develop other people's infrastructures, other organizations' staffing, workflows, and their skill set as well. I would call us maybe the tide that is raising all boats.
Working with HEALI became more than just referral. It allowed us to actually bring our best thinking, put it on the table, and see how we can make it all work to make this community healthy.
Technology is a big part of what we do. That's what we use to do our work, to get our members connected to where they have to get these resources.
It's a technology platform that all of the community-based organizations and the healthcare systems are using, as well as our federally qualified health centers and our hospital system, because then we have eyes on all of the information and we have the data that's associated to be able to measure the impact of the services and the connection.
I now have access to a plethora of resources that generally I would probably have to fight through to get to them. We now get the ability to touch lives that we normally wouldn't even see or know. So it doesn't just help us do what we do better, it helps us do more of it.
Really with HEALI, it started January 2nd of 2025, but we can see the impact already. People are getting access to the services and the resources that they need to ensure that they have a good quality of life.
There's always room under the tent for more providers with us, and we always welcome more providers. And how do we start to dig deeper also so that we have better coordinated care and integrated care, putting the person at the center so that someone's not thinking about social care over here and healthcare over here, but we're thinking about ways to bring that together.
It's about getting people the help they need because they're human beings and they're vulnerable, and we would all need that and want that if we were in that situation.
I don't know what part of a person's growth I am. I don't always get to see the flower bloom, but with HEALI, I get to see more flowers bloom than I have in the past.
All right. Fantastic, right? I think it's your fault. It's a little bit of echo, but we're getting through it. So I think that last comment that you get to see flowers bloom, I think it's a great analogy, right? All this hard work, and then you get to see that Medicaid member blossom, right? And overcome food insecurity and perhaps a housing issue, and all of that at the end. It's wonderful to see, but so much has to happen before we get to that point. And this structure that's been put in place is really doing that. And if you heard Vanessa, the CEO, at the start, she said we really got going with this on January of this year. So it is amazing what has been done to date. So thank you again to Lori and to the Social Care Network, Health and Welfare Council, the HEALI, which stands for the Health Equity Alliance, Health Empowerment Alliance of Long Island. And again, if you have any questions, you can connect with Lori. But thanks so much, Lori.
Thank you so much for this opportunity. Thanks for showing that video. We really appreciate you getting the word out for us. Thank you.
Sure. You're welcome. And you're welcome to stay if you want.
Thank you.
So, where are we going next?
Having a tough time with the slides here.
Okay.
Please.
Yeah, I insisted that we had a meet in the conference room. And Brooke's like, oh, I don't really, I'd rather not. And I'm like, no, we have to. And she kind of didn't want to, and
As long as you're bearing with us, it's
you'll
okay.
bear with us. And I'm probably gonna hear about it later on. I'll be in trouble. But she'll get there.
What are we talking about next? We're talking about the CHNA work group update. If I can get the slides out.
Do you want me to?
You'll get.
Let's see.
Well, I can talk. While she's trying to find those slides, I can talk a little bit about what's on the next slide, right? We want to talk about some of the updates and the work that's being done. And community health needs assessments for hospitals, community health assessments for county health departments are due in a couple of weeks. We did have a work group together that had been meeting all of this past year to look at data, to determine what would the priorities be, and here they are. After we looked at all the data, after we looked at the key informant interviews that we conducted and analyzed, it turned out that we are agreed upon via consensus: nutrition security, preventative services for chronic disease prevention and control, and tobacco e-cigarette use. So those are the priorities that the region is working on collaboratively. Some providers and health departments are extending beyond those three, but the state really encourages that there be collaboration and cooperation on these three priorities, so that all boats are being lifted, as was said in the video, and that we're all rowing in the same direction and having the greatest impact. So they're due to the state the end of this month. We at the collaborative have some organic programming that we provide and have some metrics around that, and also do some of the social media metrics. That's to the work that Brooke does all year long. She sent out an updated Excel work plan. And if you're familiar, CEOs might not be familiar with this, but the counties and the hospitals are. There's a work plan, Excel work plan, that really serves as the community service plan for hospitals and the chip for health departments. And we sent along some metrics that you can add to your plan, not add to it, ignore it, do whatever you want with it. And that was data through November, so you can use that. We sent that out. We also in July had sent a companion report where there were sections you could just lift and pop in. And then there's just some other resources here that you can easily go to and read about.
Yes, and in case you did miss that email, both of those documents Janine talked about, the companion report and the work plan, are on the work group webpage, linked at the bottom here.
Yeah. And we did send that out too.
Yes.
Okay, so case study and
yeah, I can.
And Hannah has been leading the charge on this, and any member who is on that work group who wants to jump in and have a conversation about where we're at with this, we appreciate that too.
Yeah, just kind of an update where we're at. We, I guess about a year ago now, we, as a collaborative, voted on wanting to move forward with some sort of research adjacent projects that really kind of showcase the work of the collaborative, especially within the confines of the collective impact model. And so we decided to pursue a case study where we kind of reflect on what the collaborative has accomplished and what we're currently doing and how we can proceed to maintain relevance and, of course, our collective impact. So really the goal is to produce an article for publication that kind of showcases the work of the collaborative, or just contextualizes the work of the collaborative under the collective impact model to kind of inform the field. And of course, everyone in the group would be able to take collective ownership of this. So we are currently in the writing phase of this. We, new members, old members alike have been pivotal to creating this project and bringing it to life. Just thinking about our honoree today and Dr. Bachman and, Selena, Dr. Mermelstein, Chris Hendricks, have really been wonderful at trying to bring back some of the evolution of the collaborative, which is a really a large part of the report is looking at the collaborative over the years and how it's evolved with various health priorities and how the model has changed over the years. And so we've been really thankful to our members who have been able to kind of speak to those previous projects, and but also, of course, to our new members who have just joined and are there for the conversation. And if you don't mind, just go. Oh, yes. They're there for the conversation. They kind of provide some feedback on where we're headed in the report. They lend any sort of assistance in filling in any gaps in the report. We are hoping to have a rough draft done probably in early February. We try to meet at least monthly. It's been a very busy end of the year, as I'm sure you all know. So our next meeting won't be until Wednesday, January 28th. And really, our goal for the next meeting is to kind of look at the work of the collaborative and kind of come up with a framework that other community coalitions might be able to replicate. Evaluating what's really unique about this group and what can be reproduced in different settings. And I think it's a really reinvigorating project for especially this time where grassroots coalitions that really emphasize equity and especially in a health setting are often being challenged right now. So I think it's been, every meeting I kind of go in and I'm like, well, I haven't been a part of the collaborative for a long time. I'm trying to help write this report, but it's just a really great group where we can kind of speak to all the activities that have been done over the years. And you kind of come off every single meeting like, oh, well, that's great. And, let's, what can we do next? So if you are interested in joining us, please feel free to reach out to me at any time. My email's on the screen. And like I said, next meeting Wednesday, January 28th, and all are welcome.
Yeah, and it's moving along.
Yeah.
This was our main project for 2025. 2025, we're in 2025,
Yeah.
right? The year before, we had 3 core clusters. I don't know if there's a slide about that,
Yes.
right? We had 3 core cluster groups, and they each produced a work product, and then it's been successful, and we continue to promote that. And then this will be our work product for 2025. Maybe a little bit move into 2026, but this has been our major work product. Annalie, do you have a question, or I thought you were raising your hand? No. Okay. Okay.
Alrighty. So next, there's a lot of what we tend to cover during every meeting.
Yes.
As you know, our community health assessment survey is always ongoing. We will be delivering analysis of the 2025 survey responses in January, as we usually do. And we do have our distribution toolkit available online. We will be refreshing that for the upcoming year.
Yeah, and it's important to make sure you're using these links because there's been a little bit of tweaking in the survey over the year, particularly as the prevention agenda changed a little bit this past year.
Yes.
So please make sure those are the links you're using so that we're all collecting the same information.
Thanks, Holly.
Okay.
All right. And just as always, Collaborative Communications is our bi-weekly email newsletter. Please send us your free events, resources, and jobs for inclusion. We also have our events calendar on the LIHC website that you're welcome to submit all of your events and happenings to. And then, of course, Walk with a Doc and Walk Safe with a Doc. We'll be coordinating next year's walks really about right around now. So if you are interested in joining us or, bringing a walk to your group, we would love to do that with you. As Janine mentioned, yes, we, firstly, our Live Better campaign, which is really an awareness campaign aimed at Long Islanders about the lifestyle choices they can make to prevent and manage chronic diseases. We have kind of revamped that to align it more with the new prevention agenda and our new regional priorities. And we will be sending out shareable campaign assets early next year for you all to use. But we are kind of getting going on all those campaigns now. And we are still promoting our core cluster work products. We have our cultural competency and health literacy 101, which is actually one of the trainings hosted on the Health and Welfare Council's learning platform that they just spoke a little bit about. We also have it's really a career guide about all of the different opportunities that exist in the fields of mental, behavioral, and cognitive health care. And we also have a resource guide for young adults living with chronic diseases that we continue to promote.
And you can see these work products on our website, and it lists the particular core cluster members who really worked very diligently to bring this all to fruition.
Absolutely. A few more updates here. Janine, would you like to speak to these?
Yeah, so just a few more updates, and we're kind of winding down, I guess, at this point. So, we still want to make sure that even though there's a lot of flux because of HR1, that federal legislation, the one big beautiful bill, but we call it HR1 because that's what it really is. There are changes in Medicaid eligibility and the enhanced population that was able to get Medicaid. All that, there's going to be changes, there's going to be work requirements, right? But we still want to get to as many individuals as possible and get them enrolled in Medicaid or in a qualified health plan off the marketplace. And for, I think, the third or fourth year, the Community Service Society has turned to us and asked us to help promote and put together a campaign, comprehensive campaign to do that. And we call it Keep Long Island Covered. And we're transit advertising. We do transit advertising. I don't remember.
We'll be fleshing out the plan for next year.
First we've done transit advertising.
Yes.
Certainly at meetings like this, we call attention to it. We cross promote it, I think, when we go to our sites, because we also enroll for aged, blind, and disabled. Another part of our organization has a grant to do that. And so that's still in the works. We're part of a Safe States grant in partnership with NYU Langone. Nassau, Mineola, whatever they, Long Island, whatever they say after their name. And that has to do with pedestrian and bike safety.
And for the injury prevention.
Injury prevention around those injuries that result as a result of that. Really looking at the advocacy piece of it, but not calling it advocacy. We have to call it something else because that was another word that is taboo for some reason. So we're going to be, we have an advocacy toolkit we put together for our partner, New York Coalition for Transportation Safety, and it's going to be modified, I think, a little bit.
Exactly.
And that's what we're doing for the Safe States grant and focusing on Hempstead.
Yes.
Because of the very high crash rate in that community. We're working with Cornell Cooperative Extension of Suffolk County. They are the lead applicant for the Creating Healthy Schools and Communities grant, which is a 5-year grant. And they turn to us to serve as a subcontractor, again, for that connected to active transit, safe streets, safe routes to schools in the community. And so there's a lot of policy work, and we hope if they get the grant, we'll be doing that in targeted communities, about 8 or 9 communities that are targeted. Western Suffolk BOCES had the lead on the grant for the past go around, and now they're also going to be a subcontractor. So Cornell is the lead applicant. And then we had a conversation with SUNY Old Westbury, former collaborative and council employee, Pascal Fils-Aimé. I don't know if that name rings a bell for anyone. She's now at Old Westbury in a role as, believe she's teaching, and also a community liaison role. And there's an opportunity there just for us to offer assistance I don't quite remember the details of it.
They're going for kind of funding from the school, but they need to kind of demonstrate a need. So we'll be assisting them with their community needs assessment that they'll be conducting and kind of joining them for the ride with that work, should they get funding.
Yeah, but I like to pull this up here because it shows in real time what collaboration is and what it can do and why these connections and partnerships that develop around this table really down the road turn into something much more beneficial for both the organizations involved, but for those individuals that we are serving. I've always said we have disparate organizations. Some organizations, I know people don't like to use the word compete, but let's, for all intents and purposes, are competing, right? Come around the table and find common ground. And this is how, this is an illustration of that. And I always like to remind everyone of that.
I think we just have one more slide.
One more slide. Okay, so we're going to give you back some time.
It's all about alliance.
Yes, so if we don't do enough, we decided we have to even do more because that's just the way it is here. Several years ago, when Brooke first came on board, I had developed a kind of boutique communications service specifically for small community-based organizations and health departments and other institutions that have a very limited communications, dare I say the word, marketing budget. And so I developed this, made it like menu driven, so you would see what you were getting for your dollars. It's very reasonable. We've had a couple of clients through the years. I really haven't had a chance to promote it as much as I'd like because some other projects and development of service lines were thrown my way that kind of pushed this off to the side. But I wanted to remind everyone about this. If you know us, one of our strengths is communications and marketing, leveraging the partnerships we have made to get the word out on whatever service or program an organization might want to promote. And so just keep that in mind. And then of course what makes it good is the health policy and historical knowledge that comes because of our work here at the council that helps to inform what we're doing and really makes it, really a bargain for the amount of money, a few $1,000s sometimes, I think, is you get a whole campaign, we do everything, and just want to remind you about that. So give us a call.
Yes.
My call to action. And we're already up to the next year's meetings?
That should say 2026 because they are 2026 like meetings.
That's all right, we'll fix that before the slides start.
Yes.
So here we are, March, June, September, December. And so, we always talk about, well, maybe we should have one in-person meeting. I can't meet here in my office anymore because we moved and we downsized to a conference room that only seats 8 people. And that's not gonna work. So, I feel like maybe one meeting we should do in person. Maybe there's a location at a hospital or CBO has a nice conference room or something where we could get together and just see one another and interact. But I don't know, what does everyone think about that? At least one meeting, maybe the June meeting? What do you think? Right before the start of summer and
it would be
maybe we could hold it at the
great to
beach.
see everybody in person. I agree.
Yeah.
Hi, this is Janet from the Epilepsy Foundation, Epic, Long Island. We do have a space. I'm probably, I'd have to check with the powers that be, but it's potentially possible for us. But we are, in East Meadow, not as conducive to people on the East End. So
we're in Farmingdale State College, and we are a place that has lots and lots of rooms because we are at a teaching institution. So I'm happy to find a room to host us.
That would be perfect.
And we're in the Suffolk-Nassau border, so that's
Yes,
Yeah.
yes, that is convenient.
better.
You know, Sarah, some years ago, Tabor, you might remember this too. We held, it was called a think tank. Do you remember that, Tabor?
I do. I
We
remember.
really come up with
Was that at Adelphi?
interesting names, and we held it at Farmingdale State
We
College.
We did.
Yeah.
I remember it.
So
Yeah.
I would be, I mean, my own conference room is too small, but I could find a room on campus, especially if I have this much heads up of when the meeting is taking place.
I'm gonna take you up on that, I think so.
That would be
And
great.
in June, classes are done, so it's easy to find a room, right?
Yeah, it won't be a problem. Yeah.
Yeah.
And if that's the date that we're targeting, I could book a room right now.
Yeah. Wow.
So, and obviously if we need to change it, we could change it. So
That's wonderful. Thank you so much. We also held, I'm going down memory lane here now. I don't know what this happens to me every time we have these meetings. Tavora, do you remember this? And anyone else on the call? We did something at, I think it was Hofstra. We called it bingo like bingo, or bingo, business like bingo. And we were trying to do something different and more interactive. I don't even remember how we structured it, but that's the idea of it, was to meet with different partners, and they were like you got a bingo chip that was the partner, and then you'd fill up.
I have like a vague recollection of
Vague
that
recollection.
experience.
Yeah. Yeah, so we were looking for something different and interactive, and it was fairly well attended, and that was, I think, at Hofstra University. We did that in one of their meeting rooms, so.
No, you'll have to come up with some great creative thing for the Farmingdale experience.
yeah, I can't promise I can come up with the creativity, but space I can come up with.
Listen, at Farmingdale has that great agricultural component to it, where you grow flowers and.
Yeah, the horticulture department is the last vestige, but I'm centered in the health sciences building, so we have high fidelity mannequins. That's the exciting thing on our end.
And also I think in Farmingdale's library, there's a tower garden, which is an indoor garden that grows vegetables.
Not in the library. There is we have beautiful student gardens that are kind of on the other side of campus. I'm happy to take people on a tour of that. we have good spaces here, but I can't promise that we're going to go vegetable picking.
No, but this is like grown indoors, and I think Cornell Cooperative was able to get one of these for Farmingdale, maybe not. I thought somebody had told me that. So I think that if you don't know what a tower garden is, it is a self-contained unit where you can grow. It uses a hydroponic system where you can grow vegetables, lettuce, radishes, whatever you want indoors, and then harvest it and make salads. And they do this in a lot of classrooms to teach students about the importance of healthy foods, and then what do you do with them when you harvest them. So I don't know, that's not what I thought of. I would love to get a tower garden here at the office, but nobody, I'm the only one who wants it.
We're only here 2 days a week, so it might be hard.
I'm not here enough, but it's supposed to be self-sustaining in this hydroponic way that it's grown.
I know of a biology professor who has a self-sustaining ecosystem in his lab that has like a tank with plants above it that like the soil falls. It's pretty cool, but not one that you can pick vegetables from. So
okay. Anyway, I'll have to find out a little more about it if it really does exist, because I was thinking of taking the class that I teach at Farmingdale over on a field trip to the library. But anyway, so I don't have anything else to say other than, again, thank you for another fantastic year. It's been a tough year in a lot of ways. I think that at the very beginning of the year, when I was having my severe existential professional crisis breakdown, and I thought, nothing's going to get done. What are we going to do? Now, in retrospect, when I look back, despite everything and the obstacles that were put in our way, and I don't mean just for the collaborative, I mean for all of you and the challenges you had to face. I think we did a remarkable job, and keep our fingers crossed that everything's just going to get better from here on in. And those are my parting words for the year. Unless anybody has anything else to share, I'm happy to hear it. Ideas,
I'll just say thank you again. Thank you again for the recognition. So very, very nice.
Absolutely. Well deserved, Tabora.
Have a great holiday.
Yes, everyone have a great holiday, and we'll see you in March. But we'll be in touch, you know, probably you'll be getting a lot of assets of all the different programs. And and thank you to Nadine, who wrote a recent blog for us for the Long Island Health Collaborative. That's another thing you can do, is write a blog on a topic, not so much promoting a program or a service, but if you've got a blog that speaks to an issue or a topic, and you can weave in what your organization does in that blog, we're always happy to take that. So I thank Nadine, because I kind of put a deadline on Nadine, and Nadine is one of those people, if you tell her I need it by Thursday, that darn thing's gonna be there by Thursday. So I appreciate somebody who respects the deadline. Thank you, Nadine.
You're very welcome. My pleasure.
Yeah.
Well, happy holidays, everybody, and thank you for joining us.
And any feedback that anyone wants to send separately to me about the collaborative, do you think it works, doesn't work, what should we do differently? Happy to listen to that, because we only get better if we all talk out the issues and what we can do to improve and make this something worthwhile for all of you, so that you're not just sitting here at another meeting. That's my goal.
Thank you, everybody.
Have a great holiday.